We help build a better future when we harness the power to develop new ideas. The power to demonstrate what we're made of. To be the role model our community needs. To be recognized for who we are and what we do. The power to have the same opportunities as everyone else. To break ceilings or to build bridges. To make things happen. To start something new. ¿Y tú? ¿Qué quieres lograr? What would you like the power to do?
Good afternoon. Thanks to everyone who is joining us for this panel discussion this afternoon at Big Bang 2021. This is going to be a thought-provoking discussion focused on the invisible water issue in Texas and how to solve it equitably. My name is Matt Cromit, and I'm a director at Idaho Philanthropies. I have the distinct pleasure of moderating this discussion today, and we are so fortunate to have three water experts, Texas water experts, with us this afternoon to talk about an issue that is really central to Big Bang's theme of a new economy, water. Today, we will talk about water poverty and the large number of people in Texas who do not have reliable access to clean water. As our session title says, this is an invisible issue to most of us. However, this is a very visible issue to those who experience lack of access to water. Think about how I assume most of y'all joining us today felt during and immediately after Winter Storm Uri this February, when millions of us were either under a boil water notice or under the threat of a boil water notice. And I can say that for myself, it took and it takes these sort of crisis moments, these rare crisis moments for most of us, when you're not entirely sure the next time you'll have access to clean water, to realize how much we all take water for granted. So on this panel today, you'll hear from three experts about the more than 1 million Texans. Let that sink in. More than 1 million Texans regularly do not have access to clean water. And these million people don't take water for granted. So without further ado, let me introduce our panelists. First, we have Maria Covernali. Maria is a domestic violence survivor. She is the founder of Familias Triunfadoras and is a certified community health worker instructor. So she has worked with the state of Texas Health Department to train more than 500 community health workers in our state. She has more than 30 years of experience making positive changes in the most vulnerable communities, with a particular focus on improving the quality of life for residents of Colonias in the county of El Paso. As part of this work, Maria has developed dozens of community-focused projects, including projects related to water infrastructure. She has been bestowed many honors for her community health work in Texas, and she may be most proud of her 11 children and grandchildren. So that's Maria. Next, we also have Dr. Yvonne Santiago. Yvonne is a wife, mother, environmental engineer, and teacher. She is an associate professor of civil engineering at University of Texas, El Paso. Dr. Santiago has a combined experience of more than 20 years in the areas of community engagement, water quality, water treatment, wastewater treatment in places like Puerto Rico, New Mexico, and Texas. In her work, she helps to find innovative engineering solutions through an understanding of the balance between many of the issues discussed at Big Bang, like sustainability, social equity, entrepreneurship, community engagement, innovation, and leadership, and all to the end of improving the well-being for people. A few examples of her work include interdisciplinary projects that provide safe drinking water to underserved communities in Texas, Mexico, Puerto Rico, and Haiti, and innovation and entrepreneurship activities on water quality sensors, phytoremediation, and remote sensing applications. Yvonne holds and has held leadership positions on many statewide and national boards related to water, including the El Paso Water Public Service Board, the EPA's National Advisory Committee, and the Good Neighbor Environmental Board that advises the President and Congress on good neighbor practices along the US border with Mexico. She has been recognized as well as a community leader, far too often to list here, but central themes among these awards include engineering and teaching excellence, as well as community service. And our third panelist is Charlene Lurig. Charlene is CEO of Texas Water Trade. Texas Water Trade is a nonprofit harnessing markets and technological innovation to build a future of clean flowing water for all Texans. Texas Water Trade was founded in 2019 with catalytic support from the Hart Charitable Foundation. And their vision is durable, long-lasting water supplies in Texas that ensure future economic growth, ecological resilience, and abundant water for present and future generations, no matter income or zip code. Charlene herself is a sustainable water finance expert with extensive experience in Texas on long-range water planning, infrastructure finance, and water transactions. She chaired the Austin Water Forward Task Force, which developed a groundbreaking 100-year water plan approved by the Austin City Council in 2018. So I am thrilled to have the opportunity to learn from these water experts today. I raced through their bios with the goal of kicking off the conversation. And so I'll start with Charlene. Charlene, can you lead us with explaining what water poverty is and how many people in Texas lack access to clean water and why?
Yeah, Matt, thank you so much for having us, and to the program sponsors for highlighting this issue, which for too long has been invisible to many of us. So I think you very well and aptly summarized, Matt, what water poverty is at its core, even though the way that it's experienced by Texans really varies depending upon who they are and where they live. But at its core, it's really the question of, do you know where your water will come from tomorrow? Are you confident that tomorrow when you wake up and you turn on the water to brush your teeth or to make coffee or to make infant formula, not only that you'll have water there to serve those needs, but also that you feel safe using that water for that purpose? Answering the question of how many Texans live in water insecurity or water poverty is a hard one because we just don't track it well as a state. And Yvonne and Maria are going to really dive deep into one dimension of water poverty that many, many Texans face in a particular context of what we call colonias, which are developments that have no basic water services and often lack other fundamental services like roads or wastewater infrastructure. So that's one dimension of the problem. It's we tend to think of it in the state of Texas as a border issue, but that really is an artifact of the way that we account and the way that we track the Texans who are living in that reality of not having any water service at all. So unlike you or I, who might have a public water system like Austin Water is my provider, they treat the water, they deliver it through a centralized water system to my tap. But for, we think around 140,000 Texans, which are just a subset of the many hundreds of thousands who live without some form of basic infrastructure, they have no water service at all provided to them. So as Yvonne and Maria are going to talk about, these families are self-sourcing water. They're paying for that water to be hauled to them where they store it in tanks in their yards, or they may buy water in kiosks. Once you are aware of what these water kiosks are, you're going to see them all over, not just rural Texas, but also urban Texas. You'll see them at convenience stores. You'll see them in gas station parking lots. Sometimes there's a windmill. Other times it might have a little penguin that says water and ice. And for many, many Texans, that's where they're getting their water, and they're bringing it home and using that for all of the water needs that they have for drinking and cooking. But it's really not a border problem. The reason we think of it as a border problem is because the state of Texas only tracks how many Texans lack basic infrastructure in 6 counties, all of which are on the border. We have 254 counties in Texas. And so as we began looking at this problem, we realized that even here in the city of Austin, in collaborating with the Travis County judge, we've got hundreds of families who have no water services here in one of the wealthiest and fastest growing metropolitan areas of the state. So we believe that that exists everywhere. Beyond that, we have roughly 1 million Texans who get water from private groundwater wells, and some of those private groundwater wells are just fine. Especially if you live in an area that's relatively rural, hasn't seen a lot of kind of commercial application of fertilizer and pesticides. But for many, many Texans who are relying on those private groundwater wells, there's something in their water that if they were being served by a public water system that's regulated under the Safe Drinking Water Act, they would be required to remove from their water. And so we see that many of those individuals who rely on private groundwater wells, like those in colonias, tend to end up self-supplying their drinking water and their water for cooking through bottled water because they simply don't know what's in the groundwater well that they rely on. And then finally, the vast majority of Texans, more than 25 million of us, get our water from public water systems. But for many of those, and in particular for communities that are primarily Hispanic, those public water systems that are regulated and are funded through ratepayers, they are not providing reliable water service. They're not conforming to the federal standards that really are there to make sure that people have trust in their water. There was a study done a few years ago that found that 18% of the state is by population is relying on public water systems that are routinely out of conformance with the Safe Drinking Water Act. And that tends to be very much the case, and over a much larger proportion of the population for Hispanic, Latino households and African-American households live in that reality. And what you find as well is that those households tend to then rely on bottled water as well, even though they're paying for drinking water services. So hopefully that gives you a sense of the many different ways that water poverty shows up in Texans' lives.
It really does, and it's extremely helpful, I think, to understand the solution might be the same for many, which is finding bottled water, but the challenge and the reason for that varies across the state in a substantial way. And so, Yvonne, let's drill down into colonias. What are they? How do people live in colonias access clean water? And please tell us about the projects you've led to address clean water in colonias, and that we'd love for Maria also to chime in with your on-the-ground expertise.
Mm-hmm. Yeah. Thank you so much. Again, like Charlene mentioned, thank you for the kind invitation. I just wanted to share a few photos and some of the experience we've had at UTEP with our collaborators in the colonias in the Paso del Norte region specifically. There's colonias all over the border, but the definition that we use for colonia is a Spanish word referring to informal, unincorporated, impoverished settlements outside the auspices of local government that lack essential public services and infrastructure. So that's the short definition, and the state had a colonias office, and they did some classification based on the type of infrastructure that colonias lacked. And, water is one of those, or roads and sewer and electricity. So in colonias can be found in Texas, New Mexico, Arizona, and California, but Texas has the largest number of colonias and the largest colonia population. So approximately 400,000 Texans live in colonias. So that doesn't mean that those are the only ones with water insecurity issues. As Charlene mentioned, we have about 1 million Texans that have water insecurity issues. The colonia population is predominantly Hispanic, which is about 64.4% of all. So that shows some of the disparities in water access. And 85% of those residents under 18 were born in the United States. So this goes to show, the previous speaker was talking about the immigration issue. So this is not an immigration issue. So there are more than 2,200 Texas colonias, primarily along the state's 1,200-mile border with Mexico. So let me tell you a little bit about what we've done and what we've seen in the colonias in the Paso del Norte region. We're here at the border with Ciudad Juarez, just a stone throw away. And we have worked since 2016, our team at UTEP, in different colonias in southern New Mexico and Texas, and in Mexico. So here you see some colonias. I don't know if you see my cursor in southern New Mexico, which is right at the border with Texas. So it's also what we call far west El Paso, and then Mexico, Ciudad Juarez in several areas, and then the colonias of far east El Paso. So it's at the extremes, right at the city limit. So it's in the county. So people in these colonias use hauled water. So they pay these trucking companies to bring water, and they fill their tanks. And in general, in the colonias in El Paso, they have this large tanks, and other people have smaller tanks, but 1,000, 2,000, even 5,000 gallon tanks. It costs them between $90 and $100 to fill each tank, and they have to fill it up maybe 2 or 3 times, depending on the size of the family. And that might not seem like a lot, but it's a lot whenever you are in the poverty limit. And if you make, $15,000 a year, that's a lot of money in water. So these are some examples of some pictures of the storage practices. They usually have this ladder to check on the level, unless the tank has a way to see what is the level of the tank. So there's no way to know that if you're running low on water, unless you physically go check it out. The water supplies in colonias differ by location. And I'm just giving this as an example in 3 different places, but this is not very unlike what we expect to see in Texas, in the rest of Texas, where people have maybe a private well. And the issue is that, it might be good quality water, but we have seen a lot of wells that are too close to a septic tank, and then that poses a health risk as well. So we have an engagement process that's really important. Like the previous speaker, Catherine Coleman, mentioned, we have to have the community sit at the table with us to find the solutions to their own problems. So we go through a process of focus groups and surveys, and we sample the water. In every stage of the phase of the process, we do outreach, we do pre-intervention, health risk assessments. So it's a multidisciplinary approach. We use what we call point of use systems, which are filters that are installed at the point where they use the water for drinking. It's usually in their faucet in the kitchen, either on the faucet or under the sink. Then we do some post-intervention health risk assessments. And then, of course, we always do more focus groups and surveys at the end to assess the efficacy of our interventions and the sustainability of those interventions. So we use several health risk models to do this assessment as well. And then everything along with outreach. Some issues of concern that we found in the colonias in El Paso is stomach, skin, and scalp issues. A lot of people have issues with itchy skin or stomach aches. Some people overchlorinate. There's some algae in those tanks, and of course, microbiological contamination. People do not trust their water quality. However, the good news is that residents show a willingness to learn about filtration and water quality preservation. So we are very encouraged by that. This is just an example, and this is not very unlikely for many, many areas where we've worked in other countries as well. So there's inconsistencies between the practices and the perceptions. So I'm just going to point out a few things here. So people are concerned about their chemical contaminants in their drinking water. They're concerned about microbial contaminants. So 80% here in El Paso, in the colonias of El Paso that we sampled, everybody worries about the drinking water that will cause some illnesses. However, nobody gives additional treatment before using the water, and everybody purchases additional drinking water because they don't trust the water. So This is something that we see over and over again. So I wanted to show some examples of the point of view solutions that as engineers, we looked at the water quality and decided, okay, which filters would be appropriate. And then we don't select the filter, the community selects the filter, but we give them a menu of different filters that they could use. And these are the point of views filters that we presented in general. We, in the focus group, we present those filters, show them how they're used and how they want to use them. And then we go through the implementation phase and of course the sampling phase. In our case, we recruited a lot of volunteers from the professional organizations, the American Society of Civil Engineers, Texas Society of Professional Engineers, American Water Works Association. So they helped us install many of these filters that we provided to the communities, of course. So we went through a process of giving our engineers training on how to install these filters. And then we practiced in our labs and then went into the field and installed all these filters in the communities. The main conclusions of our projects and our engagement is that it's important. Outreach and education activities are really important, and they are hungry for that information. And they want to learn how they can improve and preserve the quality of water that they use for drinking. And the use of point of views of filters is an effective, sustainable, and low-cost alternative to reduce health risks associated with unsafe drinking water for colonias in the Paso del Norte region. We have many collaborators. This is not a one-person job. So we have collaborators from UTEP, UT Health, it's UT Houston School of Public Health, New Mexico State University, and for our work in Mexico, of course, we have Instituto Nacional de Mexico, Juárez Limpio. In El Paso, Familias Triunfadoras has been the best collaborator ever, and then we have other collaborators in Mexico as well. We have added more collaborators to our list as we move forward, and we've been funded by the EPA, the Border 2020 project, in association with the North American Development Bank. And then, of course, we are super thrilled to now have support from the Lyda Hill Philanthropies. I want to just finish this with a statement. We cannot solve our problems with the same thinking we used when we created them. And so the problem we created is that, okay, instead of providing a public utility system to these colonias, let's just haul water to them. And then that has created a problem. So we need to stop thinking or our way of thinking has to be different. We need a new paradigm of thinking to solve the issues for water, safe drinking water for colonias in a sustainable way. And Maria, I don't know if you want to tell us something for your on-the-ground standpoint and what this looks like, and give us some examples.
Thank you, Dr. Santiago. Thank you, everyone. Yeah, I'm gonna try. If I need some help translating, please, Dr. Santiago. Thank you.
I'm here.
Yes, thank you. Well, I've been working in the colonias for the last 30 years here in El Paso County. My organization is in San Elizario. San Elizario is a small town that has like over 43 colonias. Only San Elizario has 43 colonias. But before I start with the necessity of the water, drinking water, I wanted to say that 80,000 people live in the colonias only here in El Paso County areas. And I'm talking about from Anthony, Texas through Tornillo, Texas. So the necessity is big here, because we are talking to our very low income families that they live in the poverty in the colonias. Is not because a lot of people think that people who lives in the colonias is illegal residents, people that they're just with no immigration status. But let me tell you that we have a lot of US citizens living in the colonias too. But the problem here is that they don't have a job that will help them to live more decently. And when I say that is because a lot of our people lives like on a small mobile homes as small rooms made of pallets, like those little sheds. And that's one of the problems. And the other problem is that they live in without drinking water in the colonias. So it's very, very sad to see these families that some of these families, they earn like 150 or 200 a week. And they spend like $85 to fill out the water tank that they have. The water tank is, most of the water tanks are 2,500 gallons, and they spend 85 to fill this water tank for their families. So sometimes in summer, and like you said before, Dr. Santiago, it depends the size of the family. Sometimes they have to buy twice a month. Plus, they have to buy the drinking water because they can't drink the water that they have on those tanks. So they have to spend like, let's say like $30 a week buying those bottled waters for their family. So $85 to $90 plus another $25 to $30. So how they going to make it? And it's very sad to see these families. So we as a nonprofit try to help these families, and we are trying very hard to work with entities here in El Paso County to bring potable water for their communities, or to bring something that will substitute the bottled waters. In this case, the filters, the water filters. I think that that's a real good project to work with our community. This will save them money. They will save hundreds of dollars to these families, even with the illness that in summer, we have those little ones, the children, that they don't know they can't drink this water from the big tank. And sometimes they just get the home and drink the water from there. And what happened is that they got ill, like diarrhea, fever, and all that. So it's very hard, and we have to do something for these families. And I'm very, very happy to be here, you know, asking for help for these families too, who lives in the colonias.
Thank you, Maria, and thank you, Yvonne. And I mean, when you start to get into the just pure math, right, of there's the $100, $150 a week being made, the $80, $85 to fill the tank, and still on top of that needing to buy drinking water, it starts to put in perspective what types of trade-offs these families are making on a weekly basis. And Yvonne, to your Albert Einstein quote, which I'll get wrong, but was something along the lines of, we cannot solve our problems with the same thinking we used to create them. On that point, what do we do about this? So Charlene, give us an update on the solution that you and Yvonne and Maria are working on, Clean Water for All Texans.
Sure. So, we were so privileged and thrilled to have the opportunity to kind of discover each other through the Lone Star Prize opportunity that was put forward by Lyda Hill Philanthropies. So while we didn't meet in person until last week, thanks to COVID, we've all been working together for almost 2 years now to develop a concept that we call Clean Water for All Texans. That now, thanks to Lyda Hill Philanthropies catalytic support, is going to be launching a subsidiary of Texas Water Trade to meet the needs of Texans, whether they're in colonias, on private wells, or on public water systems that are not providing safe drinking water, to get access to these water filtration and treatment technologies that so many of us have in our homes today. So the point of use water treatment systems that Yvonne and Maria were talking about are used routinely by what the industry that makes and sells these water filters at Home Depot and Lowe's and other places call the Whole Foods customer. So these are customers who may indeed be concerned about the public health implications of emerging contaminants, which are a real public health concern in our drinking water systems, or they may just want to have better water for aesthetic purposes. And for the Whole Foods customer who can pay a Culligan Water or an Aquasana or another company like that several $100s to several $1,000s to put in an under sink water treatment system or a whole house system, these technologies are used today to take water and treat it to very high quality standards. For those of you who may have your own rainwater harvesting tanks to provide your tap water at home, there's an increasing number of Texans, especially down here in the hill country, that capture rainwater on their roofs, hold it in cisterns in their yards, and then run it through an advanced filtration system, hit it with an ultraviolet light at the end. I mean, these are standard technologies. The reason that the sort of households that Maria and Yvonne have been talking about have not been using those technologies kind of come down to a couple of issues. One is cost, right? So they're already at their limit, paying for water to be hauled, paying for bottled water to supplement that. These households do not have $300 to buy an under sink water system and then hire a licensed plumber to install it in their home. But on top of it, and I feel very empathetic to this because I would face the same kind of paralysis by analysis kind of issue of just not knowing what's the right system for my home, what's in my water, how do I know what's in my water, how do I select the right treatment technology, how do I know that I've installed it properly, how do I know that I'm maintaining it the right way? I mean, these are real questions for those of us who are not water professionals, we're not engineers, and we lead busy lives. For most of us, the way that we then solve the problem is just by buying bottled water. But the solution that we co-created together through that Lone Star Prize concept was about taking just a different approach to pricing and designing a service to deliver the same technologies that millions of Americans are using today to make it equitably accessible to people. And so that's why what we are launching and what we're working with Maria and Yvonne to kind of co-design through engagement with communities on the border and more broadly across Texas is a subscription-based water treatment service. So rather than paying for that upfront cost of installation and buying the system, which excludes so many from the marketplace, we worked on developing a pricing model that would have these households paying no more than what they're paying for bottled water every month to get the system installed and get it maintained. So there's a licensed technician who shows up to put it in, tests the water so we know what's in their water and selects the right system, and then maintains it over time. And I was just thrilled last week when I was out in El Paso meeting with some families to hear that subscription-based model was something that people truly welcomed because it met those challenges that they themselves face. I wanted to say just quickly to put it in context for the prices that Maria was talking about that people pay for self-serving their own water is just staggering. For those of us who are on a public water system in Dallas or in Austin, if you're using as little as 2,500 gallons a month, which is in many places, that's the lowest bracket of water use that's set up in a rate structure at 0 to 2,500 gallons a month, you'd be paying $10 to $15 a month for potable water that comes out of your tap. And there's no effort that you undertake to get that water other than paying your bill. So for families to be paying hundreds of dollars a month for that same volume of water and not being able to rely on it, really just from an economic perspective, it's staggering. And from our perspective, it indicates, there's a willingness to pay, there's a desire for households to solve this problem for themselves, that you see in the purchases of water that they're making. They're just not adequate. And that's where we think that our solution really can help to meet a gap that we think should have been met long ago by the market itself.
Thank you, Charlene. And I think I can speak for all of us on this call to say it's encouraging that during the tough times of the past 2 years, that all of you were able to devise and design such a compelling and promising, I think, solution and partnership, and just meeting each other last week to learn that this may be, that you're onto something, and that hopefully this pays dividends and for health across the state. And so, Maria, I think our audience wants to hear more from you, because I'm reading questions in the chat, and one of them is around, what happens if you're purchasing water because you don't trust the quality of your well water? What happens to those who can't afford to purchase bottled water? What are the health implications that you're seeing? And you've talked a little bit about this, but are there any other, I think, examples of what are the health issues that these folks are experiencing? And then potentially with the solution, with Clean Water for All Texans and more clean water being available, what health improvements might we see?
Thank you. Yeah, well, with these families that they can afford to buy the drinking water, what we are doing is that we have a small project that said, chlorine your water, clean your water. So what we do is that we knock doors, door to door, and we train. We do train the trainer how they can use chlorine to chlorine their water that they get in from this tank for at least for a week until they have money to buy. Or what we are doing is that we are going and taking cases of water, free water for them, for the families, especially if they have little kids, because the first thing that we are looking is their health. I think is improving their health. So I think that's a big responsibility that we have as community organization. Look for the safe of our community and who lives in the colonias and who can't afford to buy drinking water. So we are telling them, chlorine your water or boil your water. Boil your water for 5 to 10 minutes so you can have drinking water. That's what we are doing to help them.
Thank you. And Yvonne, it dovetails with the purpose of this whole conference, but also our conversation. You introduced me to a new term called peace engineering, and I'm curious if you could talk about peace engineering and how clean water plays into incentivizing peace.
Definitely. So peace engineering is an interdisciplinary approach where we apply technology, science, engineering, but also social science principles, including health, to promote and support peace. As engineers, as peace engineers, we want to provide engineering solutions in difficult situations. These situations not only include military conflict, it could be violence, domestic or drug-related, poverty, unemployment, or lack of resources, or in our case, colonias, lack of infrastructure, among others. So engineering solutions can be challenging or feasible. And as engineers, we always think we have the solution, the technical solution for everything. But if we do not involve the communities in the process of finding the solution together, in what we call design thinking, we're doomed to fail. So it's important to have the community as part of this and embracing the solutions that we propose. And when I say incentivize peace, this is a necessary term, especially for the colonias, because what I'm talking about is making sure that there is revenue for someone to foster this investment in social entrepreneurship. So this is a term that I've called ourselves, we're water entrepreneurs. And this is a necessary approach for a sustainable and long-lasting solution. Why? Well, we cannot rely on charity to help these communities. This is not a reliable alternative. It's not guaranteed to be consistent, will vary depending on the economy, the seasons, a lot of things that are not under our control. So by creating this innovative social entrepreneurship option, we can help guarantee a consistent supply of safe drinking water for these communities, and in the process, empower them to take care of their own health. And again, this fosters peace. When you have your basic needs met, you have peace. If you don't, like water is one of the basic needs, you don't have peace. Think of a time, and I think that Matt, you mentioned, of a storm when you had no water or boil water advisory. Remember Flint, Hurricane Katrina, Ida, think of COVID. You're told to wash your hands constantly. Have you thought of the unintended consequences of lack of safe water? I mean, for us folks that are connected to a public utility system, how long will it take for us to go knocking on the door of the water utility to claim that right? So you can imagine if you're a construction worker or a farm worker, you get home on a hot summer day, the water level in your tank is low, or you have grandkids, kids visiting you, and you are like, keep reminding them, don't use too much water, you're using too much water. Remember, water is not cheap. And so can you ever realize that takes away from the quality of your family at that time? So water is at a premium. So when you have the means to support and provide your family with safe drinking water, and not to worry about getting sick from drinking the water, you are empowered. You are empowered to take care of your health, among other things, and that fosters peace. And with peace, you can prosper. By the same token, when there is any kind of conflict, internal or external, you cannot prosper and there's no peace. So we can see proof of this at a larger scale in many countries. So I hope this answers the question.
It does, and I think it gives us faith that with water entrepreneurs like you all by our sides, there's a chance that incentives can be aligned, right? And that we can make it possible for people to hear a public health message of wash your hands and feel like that's something I can actually do.
Yeah.
When right now it may be a stressful directive. So one more question that came in from the chat, and then I think we'll get to our final question. And maybe this is for you, Charlene. How is the rapid urbanization and population growth in Texas impacting access to water?
So, growth, especially in unincorporated areas that have no regulatory mechanism to control where growth happens, is way outstripping the extent of drinking water public supplies in so many places. And that's the case here in Travis County. It's the case, on the border. It's really across the state, this is true. For the households or the neighborhoods or other sorts of communities that especially live in rural areas or once rural areas that have been encompassed by new growth. These are the sorts of places where there's water poverty living among us, and where people have no access to water. Their private groundwater wells, which may have at one point been perfectly safe to drink from, now face contamination from septic systems in nearby homes or by other sorts of pollution in the area. So both the quality and availability of water, how many Texans have those of us spoken to who had a reliable drinking water well for decades and decades, and the water level in their well has dropped by tens of feet within the last 10 years. And with that declining water level, the quality of the water has declined. It's no longer potable. So, I mean, it's more than a molecules of water, availability of water. It's a, safety of water kind of issue. And there's no, I'll say we've gotten questions, really great questions from so many people who have helped us on this journey about what does it mean for our solution to be putting forward solutions at the scale of an individual household, when really these are issues of collective action. And that's a really important dynamic, right? We, as a country, we have taken as part of almost like one of our founding principles, to some extent, that water should be available to all people, that we just assume that everyone has water and that this is an embedded part of our culture and our economy. And yet that's not the truth for so many people, including those who are on public water systems, where their inability to get safe drinking water from their tap water is an issue of collective action. Do you have elected boards of directors? Do you have general managers of those water systems who are compelled to manage the system for safe standards, right? What does it mean for us to be providing solutions household by household when we need to be taking collective action to invest in water for all in a way that really in some places is best suited to centralized public water infrastructure? And I just wanted to call that out because it's not either or. It hurts when you talk to a mother who does not trust the water at her home and has no alternative, even if she's on a public system or surrounded by a public system that is not serving her household, and she has no solution today. Her child needs water today, not in 5 years when the water line comes out, not in 20 years when there's a better board of directors managing that water system. It does not mean that us providing that solution through the subscription models like the one we've co-created means that we don't continue to advocate for investment in our public water systems and solutions that really provide opportunity for all. And that's just so important to the work that we're doing.
If I can add something to that, there was a comment of, people don't trust the water, and I should say, should not trust the water, right? It's not just a perception, it's a reality. So whenever the water gets delivered to these tanks, it complies with safe drinking water standards, but we've seen tanks with algae. And if anyone has a pool, you know how much chlorine you have to add to kill algae with chlorine. It's an enormous amount, and that's what they are doing, adding tons and tons of chlorine to the water. And when you add chlorine to your water, you don't bathe, let alone drink it. So it's a real issue, not just a perception.
Thank you, Charlene and Yvonne. And we are just at time, so I think I'll wrap it up. A few of the things I learned today, and I hope the audience learned, is the magnitude of this problem. We learned about the existing challenges that so many are facing in our state, but also that the conditions are changing in some ways, and some conditions are changing for the better, others are not. But we did learn about a solution that is being developed by these three leaders on the call. And I just keep going back to, I think, Charlene, your first question, which was, do you know where your water is coming from? And most of us are fortunate to know the answer to that. But there's millions in our state who do not. And we hope that this conversation has helped many of us not take that yes for granted. So at that, I guess I'll just say thank you. Thank you, Charlene. Thank you, Yvonne. Thank you, Maria. Thanks to everyone for joining. It's been a pleasure.
Thank you so much.
Thank you.
Thanks.
Thank
Pleasure
you.
for us too.
Bye.